Thank you for watching HPSM's Provider Onboarding Series video on HPSM programs and resources for members. Quality care for our members is our top priority, so we appreciate you taking the time today to join us. This is the 5th video in our Provider Onboarding Series. In this video, we'll cover how to learn if a member is eligible for coverage, programs we offer, and more. The first thing HPSM providers need to know to care for our members is to check for a member's eligibility. There are many ways to check a member's eligibility depending on the member's line of business. You can visit our provider portal, or for Medi-Cal members, you can call 650-616-2133 or visit the Medi-Cal website. Starting in 2022, HPSM is California's first ever managed healthcare plan that fully integrates dental with medical and behavioral healthcare benefits. Please make sure you familiarize yourself with mild to moderate healthcare benefits for members, as well as dental and medical. HPSM offers mild to moderate behavioral health services to members. Please make sure to use the behavioral health referral form and the Access call center if you think a member may need mental health or substance use treatment. The Access call center will route members to the appropriate system of care. You can learn more about behavioral health programs and referral by visiting the link on the screen. HPSM is also proud to offer dental services to our members. More information on dental programs can be found at the link on the screen. Cultural beliefs on health may affect perceptions of health, illness, and death, and may influence how an individual approaches these topics, including where patients seek help and the type of treatments patients prefer, and more. Use clear communication and normalizing statements to establish trust with patients, but be sure to ask about potentially relevant traditions and customs as well, as the extent to which your patients feel that these impact their healthcare decisions. Home remedies, while common across many racial and ethnic groups, may be used more often by communities of color because of cultural, financial, and trust-related factors. When treating patients, it is important for providers to remember to take a patient-centered approach and work with members to understand what remedies they like that work for them. A treatment plan can be created with these in mind to provide a holistic and more positive healthcare experience. Providing language assistance for HPSM members with limited English proficiency, LEP, or sensory impairment not only ensures high-quality care and is a contractual requirement for all behavioral health, medical, and dental providers in HPSM's network, HPSM offers free, on-demand interpreter services from a qualified interpreter by phone, video, and in certain circumstances in person. It is a responsibility of the provider to provide an interpreter for members. Members should not be asked to acquire their own interpreter. This includes requesting one from HPSM, being asked to bring in a family member, or using free translation services like Google Translate on their cell phone, and they must not be denied care because of their preferred language. HPSM language assistant services allow providers to provide information in a member's preferred language at every point of contact during a health encounter. Understanding these services will not only help you meet state and federal regulatory requirements, but will also help you and your patients understand one another so that they can take an informed and active role in their healthcare. More information on what is required can be found in your provider manual. Resources for accessing these services are available on hpsm.org. For questions or to request an in-person interpreter, email interpreters@hpsm.org. When we look at disparities by gender, the male subgroup experiences disparities in diabetes care and well visits. Gender-affirming care is a supportive form of healthcare that includes medical, surgical, mental health, and non-medical services for transgender and non-binary people. It is patient-centered, aligning members' outward physical traits with their gender identity. Prioritizing gender-affirming care is important because transgender and non-binary adults and adolescents are more at risk for poor mental health, substance abuse, and suicide. Ensuring that we have the appropriate resources and supportive, inclusive language can help mitigate these disparities. To make your practice more gender-affirming, here are some things you can do. Share and list your pronouns. Make all gender restrooms available. Use gender-inclusive language on forms and during health encounters. Ask and use members' preferred names. More tools to support providers and tips for supporting LGBTQIA+ patients are available on the HPSM website. Federal regulations prohibit discrimination on the basis of many factors, including age, race, color, national origin, disability, religion, sex, and more. The HPSM website is divided into two categories: web pages for providers and web pages for members. Some of our provider pages have content like clinical guidelines and information on how to refer members to programs that are meant to help providers support members. You can find those pages by scrolling down to the menu at the bottom of both our medical and dental provider homepages. Here are some of the most important resources for serving HPSM members, but please don't take this as a definitive list. Please check our website frequently, as we're always updating content and launching new programs to support our members. Now let's review some of our most popular programs for members. Members who have prediabetes, are at risk for diabetes, or who are having difficulty following diabetes health guidelines can contact the Health Education Department at 650-616-2165 for information about health education classes and programs. To get more information about diabetes, members can go to our health education guide online at hpsm.org/health-information/diabetes. Our Diabetes Prevention Program page for providers offers insight into how to refer members, submit a referral form, and more. Our Prenatal and Postpartum Care Program has been expanded and rebranded to the Baby and Me program. This program will continue to include our incentive for timely prenatal and postpartum care. We will also provide information on how mothers and their babies can receive more comprehensive care. Providers are required to ask members about tobacco use at the first visit, annually, and at any relevant visit. Wherever a patient is in their journey, encourage tobacco cessation by asking permission to talk about the tobacco use and readiness to quit, advising them to quit, offering brief counseling, and more. They are also encouraged to refer members to the Kick It California helpline at 1-800-300-8086 or online at kickitca.org/patient-referral. Learn more about resources, clinical guidelines, and toolkits available to support you in helping your patients quit tobacco. Visit www.hpsm.org/provider/resources/tobacco cessation resources. Here are some other addresses you might want to bookmark and review for resources. Other resources for members online include health education materials like our health tips, where we place a great emphasis on primary prevention. At HPSM, we believe preventing a disease is the most effective way to keep a person healthy. Our health education guide online offers a wide variety of health information and tips for staying healthy. Members can access our health education guide online at www.hpsm.org/health-information. Member Newsletter Health Matters is HPSM's biannual member newsletter. It includes articles on a variety of topics to help keep our members healthy. To review current and past issues of Health Matters, visit www.hpsm.org/member/resources/newsletter. Those are just some of the resources at your disposal to support HPSM members. Our website is constantly being updated with new content, so check back frequently. If you have any questions, please contact HPSM at psinquiries@hpsm.org. Thank you for watching, and we'll see you in the next video.